If we look at the word technique, a technique is a way of effectively accomplishing a task that might not always seem immediately obvious or straightforward. An example of that would be how probably most people could prepare something like white rice, but the steps that you would take in order to prepare a superior white rice is not always immediately obvious. So in this section we're going to take a look at a list of different techniques that are effective in treating addicts. Each of these techniques is linked to a clinical model, a model of therapy. Those models we'll discuss a bit later on. They're classified on a 3-point scale, first being directive, then moderately directive, and non-directive. On the one end of the spectrum we have directive, which is where a counselor will confront a client into taking specific action. On the opposite end of the spectrum we have non-directive, where a counselor will empathetically support a client into taking action. In between those is moderately directive, where we'll combine the two, and the counselor will be supportive but also assist the client into making those changes. So the first counseling technique is acting as if, which is pretty much role play, and that is individual psychology, and it is directive. The basic idea is that the client try to act out in the way they would like to in a real life scenario, so that they can explore different alternatives to dealing with those situations or scenarios. And the underlying premise is that with practice the client will start to find these behaviors a little more natural. So a good example of this is, let's say the client is having a serious problem with a family member and they want to confront them. The counselor then would play the role of the family member, and the client would explore various ways of confronting them. And obviously then the counselor in turn would also explore different ways of reacting or responding to that confrontation. And the idea then is, if they go through as many scenarios as they possibly can, eventually the client will reduce their anxiety and hopefully improve or increase their confidence in dealing with that scenario in real life. The next of these is active listening, and this is your basic counseling technique. It is person-centered and non-directive. This is where the counselor uses a cluster of skills to accurately interpret what the client is saying. Good counseling requires that we keep interacting with the client, offering affirming comments or rephrasing the client's comments to encourage further commentary, and getting as much information as we possibly can so that we can get a clearer picture on what the underlying issues are and then move towards a solution. In activity scheduling, which is behavioral therapy and is moderately directive, the counselor works with the client to initiate activities that will move the client from a previously inactive state to a more productive and vital state. Now, aside from these activities, scheduling, which is itemizing choices and strategies, can already immediately have a profound effect on the client. And this is because instead of thinking about putting some changes into action, the client is now sitting down with a counselor and actually making a formal plan of action. Next up is analogies, and analogies are REBT. They are moderately directive. This is where the counselor can use stories or even images to help a client to see something from a different viewpoint. A good example of an analogy I once heard is how in life sometimes I can miss the beauty of a tree by being distracted by the ugliness of some of its branches. And what this means is that sometimes I can miss the blessings that I do have and the things I should be grateful for by focusing more on the things I don't have or am unhappy about. Using analogy is quite an effective tool, as not everything is as clear to one person as it is to another, and using an analogy can just help us gain some of that context or clarity we need for a particular problem. Assertion training, or assertiveness, is behavioral therapy, and it is moderately directive. Being assertive is where we can express our thoughts or feelings with confidence without being too passive, as in muting or hiding, or overly aggressive, as in forceful or badgering. This is useful for clients who struggle to express anger or frustration, or are unable to say no, or allow other people to take advantage of them. They feel they do not have the right to express their feelings or thoughts. We'll cover this training in 4 different techniques, which is behavior rehearsal, modeling, exposure, and reinforcement. Each of those techniques will be discussed separately in this video. Next we have attending and listening. This is individual psychology and is non-directive. In this, the counselor learns the core of the client's thoughts by being psychologically involved. And by that we mean we keep eye contact and we pay very close attention to both verbal and non-verbal cues. Verbal cues being what the client is saying, non-verbal cues being the tone or manner in which they're saying it, and maybe even body language. An example of this is, let's say you're in a group scenario and the group has just confronted the client about some of their behavior. The counselor is asking the client if they're okay, and they're replying that they are, but they're sitting with their legs crossed, their arms crossed, and a frown on their forehead, which suggests a very defensive position or posture, and that would show that probably they're quite angry and not really being honest about how they feel. Behavior modeling, which is behavior therapy and is moderately directive, can also be called vicarious learning. This is where the client will first observe the counselor or somebody else perform specific actions, then imitates the modeled behavior. A good example of this would be a therapeutic community, where residents who've been there for some time will take on a senior role, and the newer members will observe them perform specific tasks and behaviors on a day-to-day basis in dealing with problems, being assertive or confrontational and dealing with that appropriately, being able to acknowledge their mistakes and behavior and make amends for that to other members. And by observing these behaviors, hopefully the newer residents will start to emulate and imitate that kind of behavior. Bibliotherapy, which is behavior therapy and is moderately directive, is where we can read from books or even assignments to help stimulate discussion, to help explore different beliefs and attitudes, help us reframe problems, and explore possible solutions. An example of this would be in 12-step fellowships like Alcoholics Anonymous. They have what is called a Big Book Study Group. And in that group they will read from their basic text, which is a book that is written by the founding members of Alcoholics Anonymous, explaining the solution to alcoholism they found through working a 12-step program. And newer members would be able to then explore their beliefs and attitudes towards certain concepts, gain some insight into alcoholism and the 12-step solution, and then be able to question possible barriers between them and some of those concepts like alcoholism itself, or powerlessness as they refer to, or a spiritual experience or awakening, which is their 12-step, and so on. The next, which you're probably familiar with, is brainstorming, and this is individual psychology and is moderately directive. This is an uncritical discussion of and responses to open-ended, thought-provoking questions and problems. It's designed to stimulate a list of ideas pertinent to various choices and options. The next is catching oneself, which is individual psychology and is directive. This is good for clients who catastrophize, are perfectionists, or have eating disorders, or act out in other obsessive compulsive behaviors. It raises awareness of the client's self-destructive behavior patterns and irrational thought processes. The clients then learn to anticipate these events and change their behavior. And this should play out in a 3-phase cycle where at first the client will act on these behavior patterns or irrational thought processes and then suffer the consequences. But as their awareness grows, they will learn to be aware of the problem as they are in it, until eventually they want to reach a point where they're so aware of themselves that they actually avoid these patterns from playing out altogether. Challenging, which is choice theory and directive, is an invitation to recognize thought processes or behaviors that are self-defeating or harmful to others, or sometimes both, and then to change those behaviors. A good example of this would be group therapy, where group members will confront each other about their behavior, or at least behaviors that they feel are inappropriate or detrimental in some way. As a lot of addicts are not really aware of their own behavior, it's sometimes helpful for other members who have a clearer perspective of their behavior to challenge them on that behavior so that they can become aware and then address it. Next is cognitive modeling, which is behavioral therapy and is moderately directive. In this, the counselor performs a task while engaging in self-encouragement to demonstrate to a client how they can successfully talk themselves through a task. And this is similar to positive reinforcement or self-affirmation, where it's believed that what we tell ourselves can have quite a profound effect on our subconscious. So, for example, if we keep telling ourselves that we cannot perform a particular task, the chances are that we won't. And if we tell ourselves continuously that we can, we will then have a much greater chance of success. Next is cognitive restructuring, and this is behavior therapy and is non-directive. This is where the counselor helps the client to identify and evaluate their thoughts, replacing negative ones with more realistic and appropriate ones. What tends to happen in active addiction is that addicts will generate a negative perception of something or someone based on an assumption, and they will just write it off and never really revisit it to find out if it's based in any real fact. So a good example is, let's say that the client is saying that they have a colleague at work that just doesn't like them and never has. You may explore that further to find that that colleague, maybe a year or so ago, had made a cup of coffee for a few people in the office and had left them out, and they felt rejected. And although there was no evidence thereafter to suggest that they had a disliking for them, they had just assumed that that was the case and then never really thought about it again. Another example is, let's say a client is saying they're not capable of speaking in a room full of people. And then you explore that further to find that this perception is based on one negative experience that they had quite some time ago, and then they had just never bothered to try again. So we need to look at where our clients' perceptions are coming from, because in the case of addiction, we will find that many of them are not really based in any reality at all. Next is congruence, and this is person-centered therapy and non-directive. In this, the counselor is honest and consistent in their word and behavior. And we spoke about that before in being reliable. The client should almost find us predictable in manner and know that when we say we're going to do something, that we will, and that every time they meet us, they will find the same kind of attitude, the same kind of mannerism, and this creates a safe and comfortable environment for them to share with you. Next is a contingency contract, which is behavior therapy and is directive. And in this, the client and the counselor develop a contract designating particular behavior to be performed or changed. Rewards are then based on the achievement of these designated goals. And this contract should have the relevant information as well as a time frame. So a good example of this would be, let's say the client is in treatment and they are told to address certain behaviors, and if this is done successfully in a time frame of, let's say, 2 weeks, they will be given a weekend out with their family. And if they don't succeed in that task, then they don't get that weekend out. Continuum line, which is REBT and is directive. In this, the counselor gets the client to rate their feelings about addiction on a scale of 1 to 100, 1 being the worst, as in they hate it, and 100 being the best, as in they love it. This helps us to see where the client is in their treatment process and generates a middle of ground option for those that are manifesting black and white thinking. Contracting for change, which is transactional analysis and is directive. This is where the counselor and the client draw up a contract specifically stating what they intend to change or do in order to reach self-designated goals. Here the counselor acts mainly as a witness and facilitator. So let's say the client decides when they're leaving treatment they want to do 90 AA meetings in 90 days. Then they draw the contract up with their counselor, and that creates an atmosphere of accountability in order to reach those goals. Counter-conditioning, which is behavior therapy and is moderately directive, is also known as reciprocal inhibition. This is where the client practices responding calmly to a stressful situation using techniques like breathing deeply, stretching, or relaxing their shoulder and neck muscles. Decatastrophize, which is cognitive and directive, is where we use what-if questions to help a client to see where they may be blowing some of their problems out of proportion in their minds. This reduces their anxiety and creates a more positive collaboration and cooperation between the client and the counselor. So let's say, for example, the client approached the counselor and said, "I'm not sure I can come into treatment for my addiction because I'm afraid I might lose my job." The counselor could reply to that by saying, "Well, what if you lose your job? What would happen then?" See, most addicts will never really thought that far. And once you explore those possible problems and possible solutions to those problems, you may find that it really wouldn't be as bad as they thought it would be at all. In fact, it still wouldn't be as bad as if they never sought help for their addiction and ended up losing that job and possibly their lives. Description, which is existential and non-directive. This is quite simply where the client tries to describe to the counselor in as vivid detail as they possibly can what they are feeling and experiencing, thus facilitating a better understanding between them. Disputing perfectionism, which is REBT and non-directive, is where the counselor shows the client who thinks they need to be good at everything how perfectionism is self-defeating. One of the manifestations of the addict's obsessive-compulsive nature is this perfectionism. If I can't have it perfect, I don't want anything at all. And having such an overly high expectation, an unrealistic expectation of oneself, will never allow the addict to be able to live in any kind of peace or happiness. Diversion, which is cognitive and directive, is quite simply when a counselor distracts a sad or anxious client's attention away from the current concern, breaking an emotionally laden thought pattern so that they can bring them back to the appropriate treatment track. Empathy, which is person-centered therapy and non-directive. We've already discussed this in some detail, but to keep it very simple, if the counselor sees the client's world as if immersed in that world, as in if they've gone through the same experiences and traumas that the client has gone through, they can then assume the internal frame of reference of the client and be able to better understand the client's private pain. Encouragement, which is personal psychology and is directive, is where the counselor praises the client's strengths, their progress, recognizing, labeling, and accepting their positive qualities. This helps to build their self-worth and self-confidence. A mistake that I see some counselors make is that they focus most of their energy on the negative qualities because they feel that these are the areas that need change. But they don't spend much time acknowledging the positive strides that the client makes into their behavior or their thought process. We need to remember that the client relies quite greatly, or at least gauges where they're at in their treatment by the feedback from the counselor. So if the counselor never really has anything good to say, the client is going to assume that they're not doing well. Exaggeration, which is gestalt and is directive, is where the counselor asks the client to exaggerate certain body movements, gestures, postures, or movements that may communicate a significant meaning. The client is asked to repeat this over and over until the feeling attached is intensified enough for the client to be able to gain a better grasp and understanding of the behavior. Extinction, which is behavior therapy and is moderately directive, is when undesirable behaviors are discouraged and eventually eliminated by removing the rewards that stimulate the behavior. So, for example, if a child is throwing a temper tantrum and we react to that temper tantrum, we then reinforce that behavior. Whereas the theory is if we don't react to that behavior and ignore the child, the child will eventually realize that they're not getting the reaction that they wanted and then cease that behavior. Feedback, which is behavior therapy and is moderately directive, is where after hearing and processing as much information as we can from the client, we then provide them with encouragement and honest, specific, constructive suggestions on how to modify negative behavior and replace it with positive behavior. The fruit basket technique, which is REBT and is directive, is where the counselor shows the client a basket of both good and bad fruit, demonstrating to the client that although they have flaws and have done some bad things, they also have good virtues and underneath are a good person. And you can use any kind of analogy to demonstrate this as well. And one I like to use is helping the client to see themselves on a spiritual level as a vessel, and that vessel contains both positive aspects and negative aspects, negative being things like fear, resentment, guilt, and so on, and positive things being love, forgiveness, empathy, and so on. And what we really want to do in recovery is to eliminate or diminish as many of those negative traits as we can, and to grow and develop the positive ones to become overall a healthier person. Goal setting, which is interpersonal and is directive, is brainstorming specific objectives and strategies and then arranging your emerging plans into the best sequence or order. This mobilizes the client into taking action. This is quite an important part of your treatment plan, as it's important for the client to have both short and long-term goals. They tend to feel quite lost when they first come into recovery, and setting goals helps them to have a purpose and something to work towards, as well as structure. And as the client achieves each of those goals, it also helps to develop their self-worth and their confidence. Graduated exposure, which is behavior therapy and is directive, is a step-by-step exposure to real-life situations where a client gets to practice skills or preferred behaviors in anxiety-provoking situations. Where this technique is commonly used is in therapeutic communities in an inpatient treatment system, where if patients mix with a lot of other patients, they get to, in a smaller, more controlled environment, deal with some of the kinds of situations they would have to deal with in life later on. Some of these would include learning how to mix with other people and form appropriate and constructive relationships with them, learning how to deal with confrontation or being confronted, learning how to cope with anger or stress levels in interactions with others, and so on. Graduated task assignment, which is also behavior therapy and directive, is where clients learn to reduce their anxiety while developing new skills by taking an assigned task. And that can sometimes be given as homework, where they begin with a task that is very simple, but gradually becomes increasingly difficult or complex. And a good example of this is where a counselor might ask a client to quite simply, during each day, become aware of and maybe even write down negative or self-defeating thoughts that lead to negative behaviors. And gradually over time, as they assess these thoughts and understand where they're coming from, and the client starts to gain more insight into these thoughts and awareness, they can eventually move to a place where the client can disarm these thought processes while they're happening and actually avoid the negative behavior altogether. Helper self-disclosure, which is individual psychology and is moderately directive, is where the counselor shares appropriately some select and focused experiences, behaviors, and feelings with the client. Appropriately is the key word, as you don't want to share anything with your client that might damage their trust and respect for you. And this helps to develop the relationship between the client and the counselor. It makes things a little more comfortable, and it can encourage the client to discuss more openly some of their hidden thoughts and feelings. Now, there's some debate as to whether a normal person, and I use the term loosely, becoming an addiction counselor is any more or less effective than an addict in recovery becoming an addictions counselor. And we're not really sure, but a definite benefit that addicts in recovery have in counseling is identification. And by that we mean that many of the experiences that the clients are currently going through and have in the past, the counselor has also been through and can share about those experiences and how they got through them to help the client. This breaks down many of the barriers experienced in the beginning of the client-counselor relationship, as the client will very quickly feel that they can speak openly with the counselor without a fear of being judged, and knowing that many of the experiences, or at least the things they've done, the counselor has done similar things too. Humor and jolting language is REBT and moderately directive, and I feel is a very important part of counseling. It really helps to lighten up the mood, especially after some serious discussions about very delicate topics, and it helps the client to relax and encourages them to open up more. Even using sarcasm can sometimes help a client to identify their irrational beliefs and to even laugh at their own behavior. Imagery, or guided imagery, is cognitive and is directive. In this, metaphors and or pictures or images are developed by the counselor and the client to help the client to gain insights into their thinking and to help the counselor gain a clearer impression of the client's automatic thoughts. A good example of this, or a commonly used one, is where a counselor asks the client to draw a picture of themselves with their family. And how the picture is drawn, or the placement of the members of the family and how they are drawn, can give quite an insight into how the client sees their family and the relationship they have with the various members of their family. Immediacy, which is individual psychology, and directive, is probably where the real magic in counseling happens, and one of the most important of all of these techniques. This is where we're addressing what is going on in the present counseling session and helping the client to see that what is occurring is a sample of everyday life. It's also where we share our hunches on what the client might be thinking, feeling, or experiencing, and helping to link that to the client's issue. Examples of this would be if we were to say to the client, I notice that you're responding very defensively to what I'm saying, even though I'm listening quite openly and acceptingly to what you're telling me. I feel that this is because I'm getting closer to the truth. Or saying to the client, I notice that you haven't looked at me throughout the counseling session and I'm feeling quite shut out. And I'm feeling that this is because you don't want me to address this particular issue. So this is where we use that intuition that we were discussing earlier on in the video to address what is going on for the client in the here and now. Because it's a lot easier to look back on reports and look at information that we've gathered and try and figure out what's going on, but a lot harder to do in the moment. Language exercises, which is Gestalt and is directive, is an examination of the client's speech patterns, helping to raise self-awareness and take personal responsibility, acknowledging their own thoughts and feelings and actions. Example of this is where a counselor might ask the client to change certain words in their sentences by saying things like I rather than we, or saying won't rather than can't, and so on. A good example of this is when sometimes I'm in a group scenario, clients will try to avoid responsibility by generalizing or speaking plurally or for the group by saying things like we drink too much, we hurt our families. Where I would shut them down and tell them to take responsibility by saying I drink too much, I hurt my family. The Magic Wand technique, which is individual psychology and is directive, is where the client pretends that they have a magic wand that they could wave that would help them to see past their current circumstances into a future where they could achieve whatever their current goals and objectives were. But in a realistic sense. And those would usually be along the lines of if I had the right job, or if I had the right relationship, or money, that things would change for me and I'd be happy and I'd be able to stay clean. And we know that outside circumstances never change inward reality. So this is where the counselor can explore with the clients, if you had these things and if this became the case, what would change about your life, or more importantly, what would change about you? And examples that I've had where clients will say to me, well, if I could just get my wife and kids back, then I'd be happy, then I'd be able to stay clean. Where I would explore that with him and say, well, you had your wife and kids before, and that wasn't enough, and you weren't able to stay clean then, and so on. Offering options, which is individual psychology and directive, is quite simply where, after gathering all the information we can, the counselor offers the client a choice among several options. Paradoxical intention, which is reality therapy and moderately directive, is where clients are instructed to exaggerate certain debilitating thoughts or behaviors, helping to increase awareness of how out of proportion their responses to these situations might be. This can also be referred to as prescribing the symptom. The idea behind this is that if somebody does something that makes them feel uncomfortable excessively, that eventually that might reduce the discomfort. So for example, if somebody doesn't like a messy home, that they then don't clean their home for a period of time and maybe even add some dirt. Or if somebody doesn't like speaking in front of large groups of people, to then do something that forces them to do that quite often, to then walk through those fears until eventually they feel more comfortable. Playing the projection, which is Gestalt and is directive, is where clients pretend to be on the receiving end of some of the comments and statements they may make about others. These statements, which are often projections of attributes that the client themselves possess, help the client to bring about more of an awareness of their own personal inner conflicts. And I've seen this many times in counseling, and especially in group scenarios where clients who possess the same attributes generally don't get along with each other. We also call this mirroring. And that's because of the identification or the relation that is happening, sometimes even when the client's not even aware of it. Like arrogant people generally don't get along with arrogant people, and so on. A good example is where one client might spot another one deflecting from uncomfortable or painful situations with humor, and they'll notice that because they themselves do it. And what's often a good tool is for the counselor, if they see this, to get that client to write down the name of the other person and everything they would like to say to or about them, and at the end of it cross their name off and put their own name, and then read it back to themselves. The push-button technique, which is individual psychology and directive, is where clients close their eyes and picture alternatively pleasant or unpleasant experiences, and then focus on the feelings accompanying those experiences. This helps to teach a client that they can create whatever feelings they wish by relying on their thoughts. Reframing, which is cognitive and directive. Reframing helps us to provide a different interpretation to the current situation. So helping the client to see their current complaints from a different angle or point of view. Let's say a client is telling you, I'm so depressed right now about my situation, I'm in treatment, I don't have a relationship, I don't have children, I don't have a job, there's really nothing for me out there. You could reframe this by saying, well, maybe this is a good thing because you don't have those added responsibilities out there to worry about, so you can focus on what is most important in your life right now, which is your recovery from your addiction. Or let's say the client calls you up saying, I've just been retrenched. I really hated my job, but at least it was paying the bills. You could reframe that by saying, well, maybe this is a positive thing because it will push you into finding another job that you might find more fulfilling, beneficial, as you hated the previous job anyhow. So this is where we help a client to see what might seem to them as a negative situation as a more positive one. Reinforcement, which is behavior therapy and directive. This is based on the reinforcement theory of motivation by B.F. Skinner, where reinforcement can be both positive or negative. And in positive reinforcement, we add a stimulus to increase the desired behavior, and in negative reinforcement, we remove a stimulus to increase the desired behavior. And both are supposed to be as effective, But a good example would be is if a client were in treatment and they were behaving really well, you would add a stimulus or perk by acknowledging them and giving them affirmation in a group scenario, and then maybe a perk like being allowed out on weekends or being able to use a gym. And if they were behaving badly, you would remove the perk, so removing their rights to go out on the weekends and their allowance to the gym, thereby also pushing them to increase the desired behavior. REBT self-help form, which is REBT and directive, is where the client fills out this form and the counselor uses it to determine the extent of the client's faulty beliefs. These self-help forms can be obtained from the Institute of Relative Emotive Therapy. Role play, which is behavior therapy and moderately directive, is similar to acting as if, where playing out different roles will enhance the client's ability to be able to interact effectively with others in different situations. So clients are then asked to take note or keep track of difficult situations that they experience in real life, and then one of these will be chosen for a role play scenario in which the counselor will either be coaching or modeling the behavior. After the role play, which is where the client will then act on that situation and then create their own scenario, the counselor then will provide a feedback showing what the client's strengths and weaknesses are. Self-monitoring, which is cognitive and is directive, is where clients monitor and record their thoughts, maybe in a journal, either before or during problem behavior. And they will then disclose these thoughts with the counselor, and this can help provide overall awareness, as we've discussed before, and then maybe clues and insights into the behavior and its treatment. Sharing hunches, which is gestalt and is directive, is where the counselor and other group members share their feelings and perceptions of other group members, usually in the form of an intuition or a hunch. This helps the client to see how other people perceive them and what is possibly going on for them. I think it's important here to say that we always are careful to say that I have a hunch this is what's happening for you, or I have a hunch this is how you're feeling, because we don't know it for a fact in that moment. And if you tell a client that they are doing or feeling something that they're not, it then damages your credibility with the client. So a good example of this is actually about a week ago we had a girl who had come into treatment for drug addiction. But what other group members were noticing was that she was underweight and that she would eat very, very little. And after every meal she would disappear up to the bathrooms. So in the next group, the certain members of the group brought up as a concern that they had seen this and noticed this, and that they felt and had a hunch that she was bringing up her food upstairs, which indeed it actually turned out that she was. So exploring these hunches is sometimes quite an important thing, because even though you have small pieces of the puzzle, you're not 100% sure what's going on, but by sharing the hunch you can then explore that and hopefully, if the client is receptive, will then acknowledge what is going on for them. Spitting in the client's soup, which is individual psychology and is directive, is when counselors notice that clients are gaining some kind of reward from maladaptive behavior. They remove that reward by making the client aware of the nature and consequences of that behavior. And if we look at what maladaptive behavior is, generally is when somebody tries to reduce anxiety by acting on some kind of behavior that they feel gains them a reward, but is actually has negative consequences or is not constructive or productive. So let's say, for example, a male comes into a treatment environment, and in order to fit in and to mask their inadequacies and fears around people, they are extra loud and arrogant and act very tough and that sort of thing. And although in their minds they feel they are gaining some kind of respect and acceptance, what's really happening is they're making people feel intimidated, making people feel uncomfortable around them, and in some ways even offensive. So by exposing that behavior in a group scenario, and making them aware of actually how that makes others feel, they would then on the outside be less inclined to act on that behavior because they know everyone else is aware. Staying with the feeling, which is gestalt and directive, is where clients experience unpleasant or uncomfortable feelings and emotions, and the counselor encourages them to stay with these feelings. Because as they learn to confront and experience these negative emotions, the client then develops the courage to know that they can get through them, and growth through experiencing that pain. Because addicts have masked the way they've felt with substances for a very long time. And once they come into recovery and the drugs are out their system, they will start to experience emotion and feelings more and more. And it's by then dealing with those emotions using different solutions to substances that clients will be able to build up courage that they are able to recover and that they are able to live life on life's terms without needing a crutch. Systematic desensitization, which is behavior therapy and directive, is where clients will imagine various scenes and help them to overcome fearful responses to anxiety-provoking events. So the counselor would ask them to relax, and then choosing from a list of pre-prepared events, they would choose the lowest level of anxiety-producing situations until the client can think about them in detail and respond calmly, and then move on to a more stressful situation. They would repeat this step by step throughout the list until eventually they could respond to the highest anxiety producing items on the list with calmness instead of fear. Teaching the ABC model, which is REBT and directive. The ABC model is based on the idea that irrational beliefs are the core of an individual's problems. So A would be the activating event, B would be the belief about the event, and C would be the consequences of the belief. It teaches clients that it is the irrational belief and not the event itself that leads to the subsequent feelings and behaviors. And this I see with addicts all the time, because an addict can perceive a situation completely differently to everyone else in the room. And I'll go back to the example we used earlier about a peer making coffee at work for everybody else except the addict. Now the addict's belief about that event would be that the person dislikes them, and it might not be the case. And rather than checking that out and approaching the person and saying, hey, you made everybody coffee, why didn't you make me coffee? The addict will just stick with a belief and act as if it's real. And then further on down the line, eventually will act out on that belief and end up with the consequences because the other person is completely oblivious to what's going on. Last, we have the two-chair technique, which is gestalt and moderately directive. Similar to role play, in this the client will set up two chairs opposite each other, and as they switch chairs, they will switch the two different roles and dialogue with themselves, playing out various scenarios.